Hello, it's Dr. Kait Chang at Calgary Menopause Wellness. At our clinic, we offer intravenous infusion of vitamins, minerals, amino acids, antioxidants, and herbal constituents. IV infusion of nutrients is great for people who have chronic infection and inflammation. In any given infection, the body undergoes immune storm where immune cells are gathered together to expel pathogens. If an infection is not resolved because the pathogen may be stronger than the immune system, after a long time, the body will become depleted of nutrients. Specifically, the cells within the body will become depleted of nutrients. IV can help with that because IV can bring nutrients to cells directly. Now, some people might not have chronic infection, but they may not feel well ever since a infection, for example, like a stomach flu or stomach bug. It may happen after an infection after surgery, a root canal infection, or shingles. If that was the case and you feel that resonates with you, IV can really help you with saturating the cells with nutrients where it has been missing. Now, that's very similar to inflammation because similar to an infection, the body will undergo an immune storm where inflammatory key players will continue to exhaust nutrients in cells. So common factors contributing to inflammation include autoimmune diseases, which is usually caused by stress or big hormonal change, as that's seen in menopause, postpartum, puberty, sometimes even surgeries like hysterectomy. Other factors contributing to inflammation would be poor diet, smoking, either first-hand or second-hand, sleep deprivation, and even excessive exercise can contribute to chronic inflammation. So people who come in with either chronic infection or inflammation, they might experience arthritis, heartburn, low energy. Insomnia is really common, increased episodes of panic attacks, increased sensitivity to light, to medications, to odor, to chemicals in the air. People who have long-term inflammation might also have vertigo or sudden weight changes, either is gaining weight or losing a significant amount of weight. Abdominal cramping is also common, and bloating with even just the slightest amount of food. Endometriosis, heavy bleeding, itchiness on the skin or rashes are also symptoms of chronic inflammation. The number of IV sessions required is usually between 4 to 8 sessions. Now, cells depleted in nutrients are not very efficient at absorbing nutrients. And so usually it takes 4 sessions for cells to shift, and it takes 8 sessions to completely satisfy the cell's need in terms of nutrients. So by 8 sessions, cells should be saturated with nutrients. Now, IV nutrient infusion is a great complement to oral supplementation. The oral supplementation helps to heal the cells in the gut, whereas IV nutrient helps to heal the cells outside of the gut, so the rest of the body. Each IV session is about 1 to 2 hours, depending on the volume that is being infused, the nutrients that's selected. Some nutrients are more irritating to the veins, so they might take longer. For example, glutathione and vitamin C might take a bit longer. And then the rate of infusion also depends on how well the patient tolerates. That's IV nutrient infusion in a nutshell.